You're up, Bob.
You're up.
All right. This is the December 8th, 2020 Board of Health meeting. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30, Section 18, and the Governor's March 23rd, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the West Newbury Board of Health will be conducted by remote participation to the greatest extent possible. The first order of business is going to be reviewing the minutes of the November 10th meeting, which I will excuse myself because I was not present.
Tom, I'm all set with the minutes. Are you?
Yep, I approve.
I approve.
Okay, the next order of business is the steel landfill.
We're status quo on that. We're testing the groundwater and believe this week and next week we're doing the gas vents. So nothing new since last meeting on the landfill. Just following through with the testing requirements for the deed.
Okay, we've still got about 10 minutes till we invite the public to speak, so we'll continue. The next thing on the thing is to discuss the January meeting, January 2021. Or a meeting date, rather.
I'm just looking at the schedule.
We've kept the same schedule as what we used to prior to COVID. It would be the January 12th and then the 26th. One we could just schedule for the 12th, and then if we need to pick up another one, we could do it at that time.
I agree.
Works for me.
Okay with me.
Okay, discuss the fiscal year 22 budget proposals. I like the old system better.
We haven't gotten our original forms yet, Bob. It's just me.
Oh, okay.
On the car, yes. There was, because I was purchasing that other vehicle.
The one thing you have to think about is the revolving fund, and I think last year you decided on 150,000 for the curbside.
Holder, correct? Yeah. Oh, it's a lien holder. Advanced auto. The shop. $4,640. What? Did you pay it? Absolutely, yes. Did you pay it?
Like I muted you because I was getting interference from whatever's going on in your house.
I don't think anything is. Can you hear something?
Again, so let me do it again. Yes, and stop.
Yes, and pursuant to the contract. Ms.
No, it's not Blake.
Entitled to their money back because in order to fix the car.
There it is. It's Blake.
He's yakking away now.
I asked my wife to turn down the TV. I'm going to see if this works.
Oh yeah, that was the TV. Yep.
Could you hear it?
Yep.
Yes.
Thanks, Carol. Guys, please don't think I'm always nice to her. Okay, I appreciate it.
Okay.
The only question I have on the budget, are we on the budget still? I know we're looking at it. As far as health nurse, do we just keep the standard and then whatever proceeds with whatever goes on with this whole COVID, we take it from a special, I hate to use the word fund, but I think you guys know what I'm asking. Are we just going on the contract price?
Well, that one account we can always leave as the contract price committed to that, and then we have those other accounts set up for incoming.
Okay,
I would say at this point, we have to keep it the same, and then as we get closer to the final submission date, we may have to modify it once we
Okay.
get more information, because, you know, otherwise, we do anything different now, we're gonna be winging it, and we're gonna be winging it a month from now, but at least we'll have a little more data as to what we need to put in for you.
okay, that's my only concern. I don't know if anyone else has concerns, but
So I'll leave that at 8175.
Yeah, for now, I guess, yeah.
And the waste collection, you guys review that one?
well, that's, where is it? Hold on.
Kind of like in there. I have it broken down by the contracts.
Yeah, I see
Yeah.
that.
Yeah, I see it. Yep.
No offense, seeing, I mean, maybe it was on my behalf. Is it possible we could take up this budgetary thing? Maybe, do we need this by January 1st, Jane?
It's gonna come quick, but as long as you guys are reviewing it, we can decide really quick. You don't have to do it tonight.
Okay,
Yeah,
You want to postpone it?
My office hasn't set any kind of deadline. We haven't sent out the budget package for FY22 yet, so.
is this something we could address where we just said, January 12th? Would that be too late? Agnes?
No, that would definitely not be too late. The soonest I would present a budget based on the last 2 years would be late January to mid-February. So January 12th would be very timely for me.
Okay. I don't know about you other two board members. I personally would like a little bit more time to review this. I kind of just opened the packet tonight, and I apologize for that.
Yeah, I
Yeah.
agree. I agree personally that I'd like a little bit more time to kind of take it in. Oh, you sit down, Steve.
Bob, you
Yeah.
okay with that?
I'm fine with that because we've got a few things coming up in that trash budget that we need to make sure we're right.
Okay.
Even if we have to have a special meeting sometime in between here to do it.
Exactly what I'm thinking, Bob. Exactly. And Tom. So I think we should go on to the next, if that's okay.
All right, let's talk about the Mill Pond. Paul?
Yeah, as you know, we closed the mill pond back in the spring. We kept it closed. We've had some input from the mill pond committee members. The current permits we've been issued, they expire at the end of December anyway, so we got to do something. If the board wishes is to maintain it, keep it closed, we got to do something with all those permits all over again. My recommendation is to open it up. We can always pull it back if need be, if this COVID goes out of hand, like it did in the spring. But I think we're going to a little pickup in the positive cases. That's expected, but I don't think it's going to be drastic like it was in the spring. Plus, the weather's getting colder and there's less people out. And get shorter daylight, so it's not like people are going to be congregating out there after work anymore because it gets dark at 4:30. So I think we can probably remove that restriction on the public health side of things. And if selectmen want to keep it in place, they have the right. And if we have to bring it back, close it up for a reason, then we could always do that. But I think at this point, I think what it needs to do is keep the residents safe, and we need to keep it safe. That was probably time to open it back up.
Yeah, I'm in favor of that.
I'm in favor also.
Yep, I'm good with that.
Okay.
Paul, do we need is that a good enough vote for you, or is there?
I would say a vote like that, when you're doing something that the community wants, I don't think no one's gonna question it.
Okay, thank you, Paul.
Okay, we'll just sit tight for the rest of the minute, and we'll go to the public part of this. Okay, it's 4:45. We have asked the people from the school department and the sports people to call in with any concerns or things that they may have. I'm asking that we start from now and it ends at 5:15 as we have other things on the agenda. So if anybody would like to speak, feel free.
Robert Danforth, I'm just representing the school department. If you had any anybody had any questions, I'm here to answer them, that's all.
Okay,
Bob is the facilities director for the district, so he's the one that's going to be involved with the cleaning protocols, equipment, and things of that nature. So, in case you guys didn't know what his role was.
Okay.
Okay.
I unmuted everyone on the call, so if anyone wanted to speak, you could unmute yourself.
Hi, I'm not sure if I'm supposed to jump in line or raise a virtual hand, which I don't see available.
you're fine. You're fine.
My name's Laura Balakwa, and I'm a town resident and speaking on behalf of some of the basketball families. I know that well, first of all, thanks for giving us this opportunity to speak with you. Mr. Savigny, thanks for putting up with some of my emails this past week. I know that you all have had the opportunity to review the EPA guidelines and the MIA. It's clear that a significant amount of time and effort on behalf of some very high-ranking, very smart people have been put into this, and I know that we very much appreciate that effort. I think it also provides the recognition to the importance of providing these opportunities to engage in sports for our kids, for our young athletes. And in addition to those guidelines from the MIAA and the EEA, I know that Dr. Bartholomew has shared the district's proposals to engage safely at facilities in our district. A couple things that I don't think that those guidelines talked about were the fact that basketball is currently played in the state of Massachusetts at a competitive level. Tournaments, practices, games, they are currently going on. Second thing is, I think that if you tried to look for the research using science and the data, you'd be hard pressed to find record of on-field, or in this case, transmissions. The same as, the transmissions in some schools is low as well. And that's basically because of good mitigation strategies and practices that are exercised daily within our schools. Continue to be the case if our players are allowed to play. What we're looking for today is really a solution-based discussion. If there are concerns about certain venues, let's find another answer. Let's find other consider viable options in the district. Our boys and girls, high school athletes. Closing, just to bear in mind that the impact on our youth and our young kids, that's the part of the pandemic that we can't yet quantify. We don't know how limiting or how missing pivotal life experiences are going to impact the future. So that's looking for a solution-based discussion to get these kids playing.
Mr. Chairman,
Yes,
this is Glenn Kemper.
yes, Glenn.
I was curious, I know the governor spoke today, and he set out some new guidelines and protocols. I'm not even sure if that's the right way of saying it. Does that change anything? And second, it would be helpful if you're not talking to mute yourself, because the woman who was just talking, it was hard because I could hear everybody else like shuffling papers and stuff like that around. It would help if everybody muted themselves until they talked. But I was curious if Paul had, or the Board of Health has any feedback or information on what the governor did today and how that might affect.
Yeah, Glenn, it's Paul. So the governor rolled back, for the entire Commonwealth from phase 3, step 2, rolled it back for phase 3, step 1. That came out today at 1 o'clock. So that really, as at this point, the effect that has on West Newbury is the outdoor gathering limit went from 100 to 50. It affects other businesses like restaurant capacity, gyms, things of that nature that West Newbury does not have. I do anticipate over the next 3-4 days, maybe the EPA may come back with further restrictions and guidance, because they had a phase 3, step 1 youth sports guidance, and then they came up with another one November 7th, I believe, for 3. I'm not sure if that's going to bounce back. But again, this is also information. The COVID situation is fluid. So whatever decision the Board of Health makes tonight is still going to be day by day, process. Because if the board says yes, we may have to evaluate in a week when we different positivity rates throughout the school district. If the board says no, we may have to look at it again when things get better. So again, whatever decision a board makes, fluid. At some point we have to reevaluate it maybe on a daily basis, because as of 3 days ago, the governor was not going to make any big plans or any changes. Came out today and made them. So I don't know what's going to happen, when it's going to happen, until it happens. And usually once it happens, allow them to try to understand the new requirement.
Thank you.
Anybody else?
Hi, I think my video is trying to start. I don't know if it will or not. So I'm Chris Redding, and I'm a resident of West Newbury. I am also the school committee member, one of the 3 from West Newbury. And I just want to thank all of you for your time that you've had this year, because I know that this is not anything in your job description when you signed up to be on this board. I completely understand your point of view, because we were there as a school committee this summer making decisions that truthfully the state should be making some of these decisions. But after really digging into this, and the school committee voted to have athletics according to what is allowed for MIAA, I really feel that there is enough information out there that, given all of the stipulations that have been set forth, that the district and the players can follow those and can stay safe. I think there's one piece that was brought up at our school committee, and I brought it up, is that kids are going to be doing sports. If we don't have them here in our towns, they're going to go elsewhere. So they're going to be going places that they're going to be mixing it up with other people from different cities and towns, and perhaps bringing it back into our school system. Dr. B has said that we have only had COVID cases in the schools that have been from outside of the school. So that's social environments, so I personally think that the safest place for our kids to be doing these activities is under our coaches, under our district. We know that they will make sure that they wear the masks. It's one of the things that we've said at the school committee. We were concerned, are kids going to wear masks? Are they going to balk at that? And that hasn't happened. There's a few individual cases, but for the most part, these kids know what they need to do. beyond that, I think, you know, we have a very highly talented group of athletes who want to play. They're going to do everything in their power to stay safe and follow the directions. I know that there was some concern that because we have a building project going on, that would impact the use of the facilities. From what I've heard, I don't think that that's the case. I think our plan was to use the high school gym, the middle school gym, if it weren't for COVID. And so I don't think the construction project actually has any impact on that. You know, I really hope that as the school committee did this summer, we really looked at the science, we really looked at the guidance, we really looked at the plan that our district came up with, and we made the decision that was the right for our students. So thanks again for your time. And I certainly, like I said, I do appreciate, because you guys are doing what a year ago you couldn't even envision was be part of your committee role. So thank you for that.
That's for sure. In the 23 years I've been on the board, this is was some of the toughest decisions we've ever had to make. And we're not trained to do it. That's, you know, and again, I agree with you that, you know, the guiding factors should come from Washington and Boston, and, you know, but they're just coming up with stuff and say, well, the local boards of health are going to handle it. And we're not doctors. So we're kind of stuck in a way, if you will, between a rock and a hard place. Because you know, whatever decision we make tonight, you know, there are going to be a few people that are upset.
No, I agree.
Bob, this is Glenn Kemp, but I'd like to ask another question, but if somebody else wants to ask something, I don't want to hog up all the time.
Is there anybody else who would like to speak before Glenn does? Go for it, Glenn.
Thank you, Bob. You said you're not a doctor, but I thought you played one on TV. No, Bob?
No, wrong.
Okay.
No, it wasn't me.
Okay, you had the looks. Okay, so it might be very helpful for you guys to decide. To discuss and tell everyone what decision you're making tonight. One way, you know, I don't care about. I do care about the decision, but it might be helpful because there are a lot of people that it's mixed in here that are youth sports, like intramurals. There are high school basketball. There is a potpourri of different people that I could see that on the line that have come and actually have emailed me or talked to me, but there's all different levels. So are you guys just discussing high school basketball and making decisions on that tonight, or are you making it on all quote unquote indoor basketball pertaining to starting at the high school level and going all down to, I'm not even sure what age, but I think everybody understands what I'm talking about.
My recommendation to the board was to vote and discuss the activity, which is basketball in an indoor environment, and the location to be the high school and paid school. So I've asked them to make a decision, the user group, whether it's high school, whether it's traveling team, whether it's a bunch of whoever, they need a vote on the activity of indoor basketball at the two locations in West Newbury, which is the high school and paid school.
Thank you, Paul. It was just kind of great for some people, and they just wanted that to be, you know, firmed up. Thank you.
You're welcome. Is there anybody else who would like to speak?
Hi, this is Katie Gagnon.
Yes.
Hi.
Go ahead.
So I'm a West Newbury resident. I have 4 children ranging from age 8 to 17. So as I'm sure you understand, COVID has been pretty impactful on our family. As Laura mentioned, I'm not sure of the long-lasting impacts on my kids. I can tell you that I think I've noted in a couple of emails. The research coming out for these kids, it's not looking good. There was actually an article a couple of days ago in the AP on the rates of hospitalizations for suicides of teens right now in Massachusetts. They're going up exponentially. So I think making sure we do the right thing for these kids is really, really important. And no one's saying we need to go outside the guidelines laid out by the state of Massachusetts. As you noted, none of you are doctors. We don't expect you to like do all this research in terms of medical terms. But the MIAA and the EEA do have doctors who are on their boards who are helping make these determinations. So I think as long as we follow the guidelines that are outlined by the state and, you know, follow the guidelines in terms of where the community's at, I think we're in a good position. if you don't do that, what you're going to be doing is introducing a lot of risk from neighboring communities. Because as Chris noted, kids are going to go play in other communities. Basketball is being played in the state of Massachusetts. It's been played for months at this point. So I think controlling the risk by keeping the facilities in our communities open is the best course of action at this point. Honestly, I think you're bringing in way more risk to the community by allowing kids to go play in neighboring gyms that maybe there's 15 AAU teams playing in that same gym. So you have all those additional kids playing every day, and then the kids are coming into school. So that's all I have to say. Thank you.
Thank you. Is there anybody else?
Hi, can you hear me?
Yes.
Hi, I'm Dan Thornton. I'm the athletic director at Pentucket High School.
Yes.
So, and Glenn, this probably follows up on your question that you asked, because a lot has happened today with the governor's announcement, and there were some rumors that the winter sports season had been shut down, with us going to phase 3, step 1. But as of right now, everything is still on in terms of athletics. And at the high school, we also have to co-op with the city of Haverhill for our hockey team. So that we're obviously go by their Board of Health as well, with their rink. And we did meet or discuss this with the Board of Health in Haverhill today. The rinks are still open. So if that helps you at all, or if I can answer any other questions, those are some of the questions that came up today in terms of our sports still going on, because it has been a big question in the last 2 or 3 hours. But as of right now, the answer is yes. And as Paul alluded to, that could change tomorrow. We just don't know.
Okay.
Tom, are you still on the call? Tom Fahey?
Yeah.
All
Yeah.
right.
Can you hear me okay?
Yeah, we can hear you, but we can't see you. So you are a key player, being one of the board members. So we didn't want to lose you. Otherwise, we could be at a stalemate here with only two board members. So.
Yeah, I'm on and I'm hearing everything.
All right, great.
Is there anybody else who would like to speak?
Yeah, Bob, I have a question for Parker. I have a question.
Yeah, Rick.
Can somebody kind of, hi, how you doing?
Good.
Thanks. Yeah, could somebody explain what I know this may be a long explanation, but I don't know what the safety protocols are for high school basketball or middle school basketball. I don't know exactly what the limitations are, what protective measures are taken, and both on court and by players after they've played. Do they assume that they have some potentially higher risk because they're playing, and they therefore have to behave accordingly, or practice safer behaviors accordingly off the court as well? So can anybody, I apologize, I haven't read, there's a lot of material to read and I've only read a little bit of it. So it would help to know more.
We'll see what we can do. I mean, I read a little bit for the past couple hours before I came to the meeting. The stuff that was set forth by MIAA is pretty lengthy, including what they can put in their gym bags and all this other kind of stuff. The locker rooms are closed. There's no showers, obviously. One thing that kind of does concern me is EEA lists basketball as a high-risk sport. Another one has downgraded it to a medium risk. So, I don't know where the risk is. MIA does have quite a lengthy requirement for what the kids should do and shouldn't do. That includes the referees and everybody else. Maybe Paul can answer a little bit more of that than I can, but
like Bob said, there is a lot of guidance, and I would have referred the changes to maybe Tom wants to speak, and if you then also give Dan Thornton a chance, because there is a lot of modification to the basketball game. And obviously, being a short Frenchman like myself, I wasn't very good at basketball. So I think Dan will be a good one to ask about modification.
Dan would definitely could answer the protocol of the rules. I just want to put out that definitely going to be cost to this. Going to have to sanitize in between and all this stuff. So there's definitely going to be extra costs that's coming into it, and we got to figure out how we're going to pick that up. You know, if youth comes in and stuff like that. That's just as a facilities for me. So, okay.
All right, thanks,
Okay.
Bob. I'll let Chris speak in 1 second, Chris. But what I did want to say is I've already told my board that their decision needs to be based on public health, not at the cost, not on the user group. And if the activity is allowed in that space, then it's for all user groups in that space. And if there's a cost constraint to it, then that's in someone else's wheelhouse, and someone else is going to figure out if that activity does happen, who's paying for it and how it's being carried out. Because if the Board of Health does say yes, the cost may be so large that another group like the school district or the school committees may say, we're not paying for that. So it may get shut down at that point. But the Board of Health's role is strictly on the public health side.
Well, I understand that. That's why I just wanted to put that out.
Yeah, no, I agree. I just wanted to.
The Board of Health or anything. I just want to let you know that there will be a cost for this.
Comment, Chris?
Yeah, so I'm gonna talk two things. One, expense wise. So the school committee actually, and I'm only speaking for the high school groups because that's the groups that I kind of was involved with at this point in time. So we have a surcharge for the basketball teams, which will cover both the loss of revenue, because we usually have people pay as they go into the games, and it'll also pay for overtime of the custodians and the materials needed to sanitize the gyms. I would think that if we open up the elementary schools, we typically get money for those groups that they pay to use the facilities. I would think there would be a similar surcharge that the district, we haven't voted on yet, but that we would vote on to cover some of those costs as well. So that's the money piece of it. The other piece is, I have a daughter who's a senior who's on the basketball team, and I was very interested in what are these modifications going to be? Is it even going to look like a basketball game anymore? And, I was very surprised and very happy with the modifications, because they did things to take away that person-to-person contact. So there's no jump ball. It's going to be a coin toss. Instead of inbounding from the end under the net, they're going to be from the side. So there's more opportunity. There's already rules in place for basketball that you can't be guarding someone over a certain, number of seconds. I don't know the specifics. I watch and I cheer, but it was a very thoughtful consideration. And the group that talked about it was coaches, athletic directors, sports trainers, and medical professionals. And I really don't think that any of those people would have come up with a plan that would allow play without really making it safe. We saw some of the changes in the soccer season. They didn't throw the balls in anymore. They had to kick it in. That to me changed the game, but not drastically, and it made it work. I think also, every time the players go on and off the court, they usually tag the table and they go in. They have to take hand sanitizer on their hands before they go in and out. So that's one of the ways that they're keeping the ball sanitized. They have to wear masks at all point in time. They have to be spread out. They have to practice in small pods. It very specifically says when you have practices, they have to be in small groups that stay the same throughout the season, I suppose, unless there's a big problem. So I really think that if you go through some of those specifics, I really think that they've done a good job figuring out how to keep the kids safe. And as we found with the sports season in the fall, there were times where Pentucket went red and we couldn't play games. And so they made them up at the end of the season. There were times that another community was in the red, so it can be very, it can change given the conditions of the communities. But I think that allowing something to happen is our best course of action, and then react if we need to once either our numbers rise or we find that there's issues. So that's all I have. Thank you.
Hey, Bob, this is Glenn Kemper. I have another question, but
Yeah.
we'll sit
Go ahead.
back if somebody else has. There's a few things that have been asked of me through the weekend in emails and texts, in person coming to my home and asking me about this. Mr. Thornton's on the line. Was there any discussion about pushing this off to spring, winter sports? I understand some people have already started playing, I guess. That's what I'm hearing tonight. I'm not sure. But if that is still a possibility, because that's something I don't have an answer to, and people ask me if that was considered. And another thing, and this has nothing to do with you guys, I'm not sure how many people in our quote unquote Cal division it has allowed this to happen. But why are they, this is something that's asking me, why are those Board of Health letting those kids play and potentially ours might not? I'm not, I don't know that yet. You guys haven't taken a vote. But it might be good for people just to get that out there, those answers. One being, why can't we push this off to spring? And, and how many people are going to be playing in this division? Maybe they could hypothetically say yes, and then all the other towns, you won't have anybody to play with, or you might just have one team to play all the time.
Right. So to answer the first question, in terms of being moved off to a season, there have been some winter sports that have moved off, meaning wrestling and indoor track. They've been moved to, winter track has been moved to the fall 2 season, is which they're calling it, which will start at the end of February. Wrestling was moved to the spring season. Football, as a lot of people know, has been moved to the fall 2 season as well. Basketball and hockey, swimming never moved. It was never brought up that they were moved. It was never voted that they were moved. So those are all going on as we speak to start on Monday. And speaking for the Cal, as far as I know, all the schools right now are planning on playing basketball and hockey that are limited, that have signed up this year. They're playing. Georgetown, I know, voted last night to not have basketball in their school. But the rest of the Cal is going forward as planned. And in terms of protocols, I know people asked about the modifications that we're having. And there are quite a few. And you mentioned that the locker rooms will be closed. That's true. The benches for the basketball games will be distanced 6 feet apart. And in terms of in-game modifications, it's basically going to be, there's going to be masks have to be worn at all times by the players. Halftime has been eliminated. The timeouts, the length of the timeouts have been increased to provide some extra time for sanitizing for the players. Rosters are set right now at 15 people at a maximum. So, typical roster is about 12, but there could be 15 on each team, which would put 30 in the gym in terms of the 2 teams. Game balls will be switched out after each quarter. There'll also be 4 additional game balls provided at each game. And those are basically the primary, I think, modifications that are made to the game. But if anybody has any questions.
Mr. Thornton, I do. This is Blake Seal, one of the members. I guess I just want to make sure I read this correctly, whether it was in the MIAA or the EEA. I'm not sure which one it was. Is it true that each player can only have one guest, if that's the word you want to use?
Right now, that is false. We're not planning on having any fans at any of the games. Okay. And that goes across the board for all of our winter sports. So the swimming meets are going to be virtual. So meaning that our swim team is going to be swimming at the YWCA in Newburyport. And if they're swimming against the Ipswich High School, that's going to be in Ipswich. Basketball will not have any fans as of now, and hockey will not have fans.
And that includes parents or any siblings, correct?
That's everybody. Basically, what
Okay.
you're gonna have at a basketball game are the two teams. There'll be scorekeepers at the scorers table. There'll be referees there officiating the game, and there'll be a site manager, that's myself, and there will be, probably custodian.
Thank you. I appreciate that.
Hi, this is Matt Gagnon. I represent Pentucket Youth Basketball. And I just wanted to say, although I do represent a youth group, I feel like the priority should be based off of the high school athletes at this time. They've worked for so many years to get to the high school level, and this could be it for some of those kids. With the youth programs, I feel that if things did go well, it could go with like a phased-in approach. I just feel like it's really important to get the high school players playing in a safe environment, and I feel like that should be the priority that should be looked at.
Okay. Is there anybody else? Is there anybody else would like to speak?
So I think, Bob, it'd be good at this time if, 3 board members, give their opinion so each other of the board members can hear it. And then one of the board members can make a motion to either approve it, whatever the motion may be. But I think, to be good to hear, Blake's thoughts, Tom's thoughts, and your thoughts. And then, someone make a motion to vote on it, whatever that vote may be, and then go from there. But I think a lot of good input from, selectmen as well as our residents. As you guys know, I've received half a dozen emails from different parents, and then you guys have already read all that the information from the parents, as well as all the 3-4 guidance documents that's out there. So just to let the residents know that the board members have received all the emails that were given to me, as well as they've had a chance to look at all the guidance documents that's out there. So we're all looking at the same information. And I guess I'll leave it up to the board to, discuss it amongst themselves, and then ask that they, make a, vote, take a vote, roll call vote when it comes to that point.
Okay.
Bob, would it be appropriate if I could just give you my thoughts on this? This is Tom Fahey, I'm on the board.
Yeah, but by all means, by all means.
Okay, so what I wanted to do when I heard about this, I wanted to try to project this activity on the health and wellness of the people of West Newbury. So an excerpt from the West Newbury Board of Health mission statement states that the Board of Health helps to provide for the health and wellness of West Newbury citizens. So in reviewing this proposal, my decisions are based on this proposal to permit indoor basketball, and if approved, will it place the health of West Newbury residents at risk for contracting COVID? That's kind of how I looked at this. So in preparation, what I did is I did review the MIAA, the DESE, the Mass Department of Public Health, and the Mass Executive Office of Energy and Environmental Care Guidelines. And there's a lot of information there. I consulted with the West Newbury Health Agent, Paul. I consulted with the West Newbury Public Health Nurse and the Pentucket School physician on this. And then I reviewed the current COVID public health metrics on the Mass Department of Public Health. So I really wanted to get a sense, because I'm looking at the impact for the people in West Newbury. In my discussion of this, the MIA guidelines were designed to modify play to decrease close contact and to limit potential transmission and maintain a clean environment for indoor basketball. So when I talked to the public health nurse, I had some questions, and these were some of the information that I got. As of right now, there has been no history of any student positive COVID cases that originated from the school environment as of right now. The public health nurse can quickly identify COVID cases that originate from any sport activity and take proper action to stop any spread. So I reaffirmed that with her, that that would be something that would happen in real time and wouldn't be delayed. Recent high school students that are high school age and they have played club sport basketball has not produced any positive COVID cases in West Newbury. And that happened outside of the school sponsored. The proposed MIAA guidelines are very structured with multiple adults who are responsible for the guidance and compliance of all the participants. So there's some skin in the game for these kids to comply. Now, I do have some concerns about this. I think the MIAA states that they will monitor COVID metrics, but do not state any threshold for when they would stop play. And there's no guidelines on when to consider, team quarantining or anything like that. The MIAA defers to local public health authority in these situations. And there have been, as far as I know, no studies that can support these current guidelines will limit potential transmission. And with that, I feel at this point, we don't know if this could increase positive cases in the community. But I did do a complete review of that. So those are my comments. Thank you, Bob.
Okay. Thank you, Tom. Blake, you good?
Sure. This is Blake Seal, one of the Board of Health members. I've been on the board for 18 years, and I will say, for me, this is the most trying year that we've all have had. Like Bob said earlier, I too have looked over all the MIAA guidelines, the EEA rules, and the DESE. I too have some questions about the rules, especially the MIAA, but everything in my heart that I've learned from the last 9 months, I believe that this is possibly not a great idea, but I'm trying to base my decision on these guidelines. And once again, like everyone is concerned, for the safety and well-being of our residents of West Newbury. If this does go through, I certainly would like to supplement some things with the MIAA guidelines. Until we take a vote, I guess maybe, Bob, you want to talk?
Certainly. In a lot of respects, I have to agree with Blake. Our primary responsibility as a Board of Health is to protect the public health. Of all the kids, grown-ups, everybody. And it doesn't come just with septic system reviews or trash pickup. It comes also, one of the leading causes is the spread of diseases. One thing that Tom did say that I kind of liked the idea was that our public health nurse has her finger on what's going on, and if somebody comes down with anything, she can stop it immediately. Outside of that, I mean, I have some reservations, and I think maybe if we do vote to approve this, that the school or the district works with Paul and the our health nurse to work out some of the specifics and answer some of the questions that they may have. I mean, I hate like heck to see the kids not be able to play, but I also don't want to see them come down with anything that's going to be detrimental to their health. So that's kind of a fine line.
Bob, I would like to make a motion to approve with the following requirements, if you'd like to hear this.
Certainly.
I would like to approve the use of the gyms with the following requirements. Anybody that's using it for basketball must follow all the winter 2020-2021 MIAA guidelines for basketball. The second thing would be that the requirement for proper cleaning would be based on the Pentucket Regional School District facilities approved cleaning protocols. The requirement would that all players, coaches, referees, game officials, and spectators are required to wear facial coverings, that there would be no exceptions to this, and it would include visiting teams. That the Board of Health will monitor compliance of the MIA guidelines by the teams. That the Board of Health will monitor for Pawtucket Regional School District positive COVID cases in any case tracing that links to the indoor basketball program. And then finally, the Board of Health can withdraw its approval for the use of the Pentucket High School and Page School gyms if its use is felt to cause a public health risk. That's it.
Can't hear you, Blake.
Sorry about that, Bob. I muted myself. As a Board of Health member, I'd like to second that and urge once, because what Tom said, the only thing that extremely bothered me is, I hate to say it so rudely, but no mask, no play. And that means anyone and everyone that's in those gymnasiums. So I second the motion.
Okay, all those in favor, roll call vote. Bob James? Aye.
Blake Seal, aye.
Tom Fahey, aye.
Okay, the motion carries.
I'd just like to thank you. I know that you spent a lot of time going through all the information we threw out to everybody. I appreciate Paul for kind of helping us get that. You know, and I think when you talk about your budget next time, you should give yourselves a raise, because I think that's very appropriate at this point. So thank you very much.
Bob, if I'd like to add one more comment, please.
Sure, certainly.
Okay, even though it's already voted on, I'd like anyone and everyone that is involved in the sports, whether it be coaches, parents, children, just because we, the Board of Health, okay for you people, basketball to play, this by no means, we'd like to make sure you people realize this is a risk. And even though we said it's okay, it's up to you to make it safe. Unfortunately, the Board of Health. That's it. Thank you very much, Bob.
Thank you, Blake. Any other comments while we're still here?
Glenn Kemper?
Go ahead, Glenn.
Yeah, Bob, can I make a comment?
Sure. Rick, just a minute. Glenn was on.
I just do want to thank you guys for all the hard work. Thank Paul. Tough times, but I can't stress what Blake just said. This doesn't mean just because you guys voted to do this that it's safe, that it has to follow, and they have to even be more diligent to make sure that we keep everybody safe so the program can go to its fruition. So thank you all very much, and have a good night.
You too, Glenn.
Thank you, Glenn. Rick?
Thanks.
Yeah, Bob, thank you. I guess I just reiterate, thanks for the effort. I know this is a difficult decision for all of you, and that you've all put a lot of time in, 3 board members and Paul. But the one thing that it seems to me hasn't been adequately addressed, and you know, I don't want to seem like I don't want to seem too hard at this, but I think there should be repercussions for people who don't behave by the protocols, and I don't think there should be a tolerance policy. So, for instance, if somebody doesn't adhere to the mask requirement, that they should no longer be eligible to play. Now, that's my opinion. I'm not, you know, that's your decision, but that's my opinion. And because if there isn't any tooth to the rules, you know, and if people
Right.
take exception to them, you know, how do you handle that?
Right. I agree with you, Rick. One of the provisions in one of the, I don't know, it was MIA or EEA, one of them, there is a provision in there for a $300 fine for anybody that does not follow suit with what's going on. You know, so I mean, there is that particular portion of the law does give us or somebody the right to levy a fine. So, you know, it is in their own rules. So.
Yeah, if I could speak to that, because I think Rick brings up a great point. I think it should be one strike, you're out. No matter if you're the best player on the team or you're the, you know, you don't get in much. Because, you know, if we, you know, we're doing this at very high risk and with an understanding that these rules are going to be met. But as soon as somebody sees somebody without a mask on and that person plays the next game, we're all going to be getting phone calls. It should be a policy that's set forth by the Board of Health or by some governing body that one strike, you're out. There is no sorry, you know, this is serious stuff.
No, I agree with you, Glenn, and that should go to the youth sports people that wanted to play the game. They should be the ones that have to monitor it too.
So can I say something?
Yes.
So the school committee adopted policies with regard to COVID. And one of the first ones we adopted was a mask policy, and there is no
Okay.
tolerance to that. There are exceptions based upon medical, you know, your typical things. To my knowledge, there have not been many problems at all throughout the district and specifically the high school. So I think, you know, I don't know if Dan Thornton's still on or not, but I would say that this covers anything within the school buildings, anything with regard to, you know, high school athletics are part of the high school program, so it would be covered by this. So I would agree that I think it's necessary. I have every faith in our coaches and our seniors on this team. They know what's at stake, and they will set the example and set the bar for all of the other players that they need to follow all of the guidelines of MIAA, of the state, you know, everything else. And like, I have no doubt in that. And to back it up, we have the school committee policy that the administration has to appropriately deal with anybody who doesn't.
Okay.
Dan's up to speak, but after Dan speaks, what I would recommend the board do is modify the original motion and approved by Tom to include the wording that you want, that mask, everyone, no exceptions, and whatever you decide for, you know, no tolerance, have that part of the original vote. We can modify it now, re-vote on that. That way, there's no questions what authority or whether it's the school district or whether we go by the Board of Health youth sports mask policy in order that the board approved a month or so ago, because this is a little different than that order that was voted on by the board. So I would recommend after Dan has a chance to speak, then the board rediscuss and modify that original order just so it's clear.
Okay.
Yeah, thanks. I think you should rest assured, masks are non-negotiable. So it's pretty simply put. I mean, you're going to come to a basketball game. There's going to be few people there. Everybody has to wear masks. Officials have to wear masks. The coaches will be wearing masks. And, you know, just speaking again for the high school, the student athletes and the students as a whole have been excellent in regards to this. And, you know, I'm also the assistant principal at the high school. And I honestly can't tell you one time this year in the school that I've actually told a student to wear a mask. In fact, it's actually the opposite. I've had a few times where students have come to me and said, I forgot my mask, where we just go into the main office and we have extra masks for them. But, you know, in terms of here at the school, and especially when it's going to be in regards to playing in games in a gymnasium, masks will be on everybody. Yeah, that's again, it's non-negotiable.
Okay. You still want to put that in there, Paul, or would you rather just go with Dan's?
I would recommend it just so it's clear, clean. And then, you know, I would recommend that Tom make his motion with the same stipulations, but add that caveat about the mask, reinforce the mask thing, and then you guys re-vote on it.
Okay, Tom, you want to restate that?
Bob, can I just ask, before you revise your motion?
Yeah.
Excuse me, Bob, could I?
Yes, Rick.
One more question before you revise your motion?
Yes.
Thank you. I just wanted to clarify, and maybe I missed this in the motion, but I believe the intent is only for school sports and not for other organizations. Is that correct or not? Or I may have missed something, as I said in the motion.
I believe it was just for the school sports, right?
Well, right now,
Yeah,
facial covering order from the governor requires in public places masks no matter what, except for, medical, very few exceptions. But this order is for indoor basketball, mask requirements, no exemptions, no medical exemptions, just no mask, no play, no questions asked, black and white.
But Paul, what I meant was that it was the allowance for usage was only for school sports, not for other groups. Is that correct, or is that incorrect?
Well, I think it was just for school sports, wasn't it?
It's for those two locations.
Well, what does that mean? Because that was to my question. This is Glenn. to piggyback on Rick's question, because that's a good one, just to make sure it's clear. So if this vote goes yes, then high school sports gets to go and intramural sports gets to go with the page, following all the protocols that are in place and all obviously.
Correct. The vote is for indoor basketball at the two facilities, high school and paid school. It's not the Board of Health, wheelhouse to decide what user groups use it, whether it's high school, whether it's traveling, whether it's youth sports. They have to follow the youth team have to follow the MII guidance and do everything based on that motion. So we have one set of guidance, one process, one set of rules for every user group that wants to play that gym.
And those guidelines are at a minimum. They could go more if they wanted.
Correct. So one is one activity in those locations with one set of standards for everyone. That way, the motion was, Tom?
Pardon me?
Oh, I guess I'm asking for the board to modify that motion to clarify the mask low tolerance policy, to clarify it, and then re-vote. And then we can.
You could add just a friendly amendment.
Yeah.
What I don't understand is what more than what I'll read. I'll read what I had originally put into the requirement, and that is the requirement that all players, coaches, referees, game officials, and spectators are required to wear facial coverings, no exceptions, and this includes all visiting teams. How much more explicit does that need to be? I don't
understand. I
understand
think that covers it.
I think what was the comments was that there was no tolerance.
I can't hear you, Paul.
I think the question was that there was no tolerance. So if someone did not wear a mask or they took it off for whatever reason, then there was no tolerance. They were done.
So I think that the structure of the team, the coaches, the referees, I think there's enough intrinsic motivation there to keep everything squeaky clean. And I think that the kids want to play, the coaches want to play. They know that they're being watched and there's concerns about the activity. So I don't personally think that we need to add anything else to this. I think as the Board of Health, we can't police the activity. They have to police the activity themselves. And basically the byproduct of this not having compliance is that we potentially as a board could hear complaints about this, or ultimately, and hopefully not, we could see some positive cases because of the sloppiness. But I really don't think that that's an issue, and I don't think it's going to be, it's good for the board to do that. I think ultimately we've set the standards that what we want, and we're going to monitor, and we're going to really hope that it goes well and the kids have a great time and they play and that we don't see any problems here. So I wouldn't necessarily recommend that we need to change this. I think it's clear enough for what we need to do as a board and to try to make sure that we're protecting the people in West Newbury.
I will agree with that because, as Dan Thornton said, they're right on top of it to make sure everybody wears a mask. And I honestly don't think we need to be policing them. And like you say, if somebody notices something, we're going to hear about it. So
That's it. Shut them down.
I'm in agreement. I think I don't think we need to modify it. I believe that the coaches, I'm hoping, and I believe them, that the coaches will, if they feel as if it becomes an incident, I'd like to believe that they will throw them off the team because they know that the whole team at jeopardy. So I'd like to leave the motion the way it was and the way we voted on it and call it a night on this situation, if that's okay.
this works for me.
So if anybody has a problem, they should, call the Board of Health. I mean, you are the actually policing. The Board of Health is the police of the, the health and well-being of people in West Newbury. So if somebody has a complaint, at this point, it would be good for them to know who do they send it to. Do they send it to the school district and the Board of Health? Do they send it to the Board of Health? Because I know you're saying that you don't want to police it, and I think I understand. I would leave the motion the same, and I would agree with that. But you guys are the policing authority in town for situations like this. So if anybody has a complaint, should they send it to the Board of Health?
Any complaints, go to me, Glenn, and then I'll follow up with Dan like I have done in the past. So we work well together. So I don't foresee that being a problem.
That's exactly what I was going to say. I mean, if that needed to be clarified, they certainly call the Board of Health and call Paul's extension 119 at 978-363-1100. And then Paul will certainly talk to Mr. Thornton and or anyone else, but they always can call the Board of Health at any time.
Okay, anything else? All right, I want to thank everybody that participated. Thank you very much. And we're going to move on to our next item on the agenda.
Well, I don't think you voted it yet, did you?
Yes.
Okay, sorry.
Yeah, we did. It was,
Okay, I'm sorry. My Wi-Fi was going in and out. Sorry about that.
No, we voted on it.
Yeah, we did vote on it, Glenn, but we did not re-vote on, kicking them out of the league or anything. We left that.
No, I got it. Sorry. I'm sorry.
Okay.
Have a good night, gentlemen. Thank you very much.
You too, Glenn. Thank you. All right.
Okay, Mr. Chairman, are we on to the next order of business?
We are on to the next one, the Mellow contract, or the Mellow Cat program.
Let me get some stuff here. Automatic, there we go. Sorry if it takes me a couple minutes to get. Okay.
Thanks, guys. I'm signing off.
Thanks, Angus, for joining us.
Well, thank you, Angus.
Hey, Tom's back. Tom, you haven't visually been in the picture the whole time, or you too?
No, I've been in and out, so I'm a little challenged here, but I got the point across, so don't worry.
Well, I'd like to thank the board, or at least all Jane, Paul, Bob, and Tom for all the work everyone has done here. And you know what? I think we did a good job, and it all works out well.
Thank you.
Yeah, I hope so.
Like, thanks to all of you guys for everything, all of you guys and girl, for everything that you put in here all along. I know this is the whole COVID thing is just, it's a world that none of us expected to be in. And just from my heart, thanks a lot for everything you put into it.
Thank you, Rick.
Thank you, Rick.
Thanks, Rick.
Yeah, have
Phew, that was a tough one. Okay, Jane,
All right,
I think we're gonna be talking about,
the mellow
The cat-
card, the cat service, the automated cat fees.
Yep. Take a look at those. I think I got them from last year, right? But I'm not sure.
yeah, that's exact, yeah, that's.
So I had one
yeah.
question though. Some of the bigger items like a sectional and hutches, are we thinking 2 stickers or are we just gonna leave it at 1?
20. The only problem I have with that, Jane, is I 100%, oops, sorry, I'm sitting back. I 100% agree with you. But where do we, at what point do we break the point? You tell,
I
I
know.
mean, work
I
with
don't
us. I mean, what's a kitchen table? No,
Yeah.
you know what I'm saying. I mean,
Yeah. Leave it at 20?
Jane, you may want to check with Jason, see what his thought is on the sectionals, because sometimes you get sectionals that are 10 feet one direction and 15 feet the other direction.
Yeah. And
Corner.
usually they break them up, but that was a bad example. So use a
Don't bring
hutch.
us,
So,
don't bring us bad examples, Jane.
Well, I think that's a great example. I think hutches, one hutch, top and bottom should be one item, like a kitchen table set, but the sectional couches do get pretty big.
Yeah.
Heavy.
So
And
we
one-
can easily break those up.
Yep, I think what you ought to do is what Paul just recommended, though. Maybe ask Jason, if he thinks.
When I did talk to him, he said
Yep.
it's up to us.
Well, of course he did.
So,
Of course he did.
Jane, what document are you referring to right now?
It says at the top, Tom, automatic
Okay.
curbside collection.
Yeah.
I'm sorry.
It doesn't specifically list any items. It just says bulk item, right?
Right.
Right now, correct.
Okay. All right. Good. Thank you.
And and I guess we could always just modify it as it goes along.
No, I'm looking at Jane. I'm not ignoring you. I promise you.
That's okay.
No, I'm not either. I'm just trying to think here.
Ooh, how do we break that? That's a good question. It can't be based on weight, right? Because it's more bulk.
Yeah.
Could say if
Well, you want to think about it?
sectional goes around a corner, it's 2 pieces.
You know what I want to do is, we can't do something as idiot as this. I was thinking like per cubic feet or something, but that's probably not going to work either.
Oh my God.
No, I think if we ask, Jason on this, he's going to know the common stuff that people put out that are problem items, and then we can define it better so that we're avoiding, the 20-foot long sectional or whatever it may be.
Right.
So maybe he can give us guidance on specifically how we should word that with experiences from other communities to help us guide, and so that we write it in a clear way so people aren't challenging their $20 worth.
Good.
I know, because my other question was if somebody has 4 chairs, dining room chairs, you can ask them to pay $20 a chair.
Agreed. No, I think we're all in agreement with that.
I was wondering if we should do a set of 4, but those are, I've got to, I can figure it out.
Well, no, we need to know. I agree, but I agree with that too. We need to do. Do you want me to call Jason on that, Jane?
Yeah, I can send him an email. Because I was also wondering about swing sets and ironing boards, you know,
Right.
those were my 4 big items that I was wondering, you know, if anybody had any input.
Could you do me a favor, Jane? When you email him, CC me, so when he gets back here,
Sure.
it's not that, I like to, with trash is kind of my forte, if you know what I mean. So I like to hear. Sorry, Tom. Trash is my, hey, building block walls is yours, all right? Leave it alone.
It's been a while since I vacuumed. The last time I knew they were metal with a foam pad, so I would say they're probably be metal, but not really a bulk item for an iron.
The what?
It's been a while since I've ironed, so I would not call an ironing board a bulk item.
Yeah, I just have a big list that I've been working on, so I'm just trying to figure out everything, like child's car seat was one, a vacuum. So I'm just throwing it out there.
All right, on to the mattresses are up to 21 now, Jane?
21.
I already looked at the flyer. Are we keep moving on? Am I too fast?
No, keep going.
I've already looked at the flyer. It does look good. I know Tom had before a couple of comments. Wasn't it Tom last meeting?
Yes, and
Right?
and I think that yeah, I haven't actually looked at the
new one,
the new flyer, but
Yeah.
but I think that Jane, you did all the stuff that you considered the stuff that I had asked.
Yeah, I
Okay.
took the price out because it seems like it might change within the year. So I just told the people to call ahead, and then we would be charged $1 for every resident that uses that program.
Okay. Yep.
You good with it, Bob? The recycling calendar?
I haven't looked, I've looked at it briefly. I haven't signed it yet. I was waiting to see how tonight's meeting went. If everybody agrees with it, I'll sign it.
I've looked at it, but I don't know if I can certainly accept that it takes time to look over things.
Yeah, I just saw it tonight, so I haven't.
There it is right there.
I'll tell you what, I'll look at it tomorrow. And if it's okay, then if everybody agrees, I can sign it tomorrow.
Sounds good to me.
All right.
Yeah, I think so.
Tom's looking at it now. I can see him. Tom, we can see you too.
Yeah, I know. I'm back on, and I can see you too. Need to brush your teeth. Anyways, yeah, I'm good with it.
Okay, so it's up to Bob tomorrow, Jane.
All
Okay,
right,
that
I'll
sounds
look
good.
at it
You and
tomorrow and, yeah, I'll sign it then.
Are you're around tomorrow, Bob? You'll be in? Or you just?
As far as I know,
Okay, sounds good.
I'm only delivering packages tomorrow, so I should be done by who knows when, but I should be done.
Okay.
Sorry,
All
Bob,
right.
you take on. Forget Bob.
The proposed automated cat regulation.
Oh, yeah, just for your review, because we got to come up with something. And it's in the yellow. I just wrote that up real fast. This one is the existing one, and we're gonna have, when we have our public hearing, we're
Thank
gonna
you,
vote on
Jane.
something.
So the yellow one is what we're looking at right now, Jane, to approve or not, or you know what I'm saying?
Just to discuss, just look at it, because we'll have
okay.
our public hearing later on,
Yep.
like in, okay.
Yep.
So this is the stuff that's highlighted, right?
Yes.
Yellow, qualifying households will receive one. That's where it starts off.
Yes.
Must be used in corruption can. Instead of qualifying households, shouldn't that be all households?
I don't know, that's up to you guys. I think
What is-
Jason used the word qualifying, but I'm not sure.
What is qualifying?
If you have a legal septic system that goes with your house.
Is tight tanks count?
But yeah, I mean, change whatever. I just threw it in there.
I'm sure he put that in there because I'm sure there's more businesses and different things in Newburyport. I'm assuming some of this came from Newburyport, if you know what I mean, like stamped. So that's probably why I put qualified or qualified.
I just put that in there.
Oh,
I don't
you
think
did?
he used, yeah.
Oh, that's fine with me. That doesn't.
But we are going to figure out who is qualified. You got to figure out who gets a barrel because of the
apartments.
What do you call it? Yeah, apartments and.
So I think qualifying is actually good.
Okay.
That we'll probably need to define that though. I mean, it's because if anybody reads this, they're going to ask the same question that we're asking right now.
Right.
So that will either have to be qualifying, will have to be defined below with an asterisk or something like that, that would allow us somebody to have the definition of what we're calling qualifying.
Yeah, because right now, what is and what isn't, you know.
I don't know. You guys talked about it last time a little bit, right? Who was qualifying? Bob, I think you missed it.
I did. I wasn't here for
Yeah,
that.
it was going to be on that list, Jane. I forget what it's actually considered.
Yeah.
That you sent out to. You were going to send a copy to Jason, if I'm not mistaken.
And I did. Yep.
Right.
But I mean, like even this house down on Main Street has what, 4 apartments, and do they all get a barrel? Are they qualified?
There better not be anyone in town that has 4 apartments, right, Bob?
I don't know if there is or not. I know there's one that's got a couple.
Right, so technically there's no 3 families allowed, it's only 2 families.
That's why I just.
If it was a legal 2 family, basically you need to have separate entrances, you need to have fire separation between the 2 units, and you gotta have a separate meter. And if it was a legal 2 family through the building department, they would be allotted 2 barrels. But if it was a single family with an in-law, they would only get 1 barrel. And if they wanted more, they could buy that extra barrel.
So with that said, maybe I'm missing something. I personally like to move on, but that's up to. But I don't want to push anything. So qualifying is the right thing, and if someone doesn't get a barrel, I mean, what part of I understand what you're saying. Someone's going to ask. I agree, but. So what are we going to put something in there to identify what qualifying means? Is that what we're saying?
I think later on, yeah, you will.
Yeah,
we'll
have to define qualifying.
Yeah.
Or even what about replacing qualifying with approved? Would that be still vague? I mean, if they got if they got the zoning change to go from a single family to a 2 family or whatever, then they would be determined a 2 family, and they would get trash barrels.
Yeah, I think I like it better than qualifying. Qualifying it does stick out at you.
Approved is, you guys want to go? Okay.
I'm good. I like approved better than qualifying. I don't know. It kind of just grabs you when you first look at it.
Oh, what do you think?
What's the discussion? Qualifying, or what's 2 words you're debating?
Qualifying or approved?
I would say either way, maybe approved.
Yeah, I agree. Approved doesn't stick out as harsh at you.
I mean, you can't
Okay,
go wrong.
good. That's good for now.
Yeah,
Jane. Jane wants Hawaii 5-0s on. Jane.
That's a wrap.
Uh-oh, I had to check my little symbol. Who's on? Oh, all right. You want to move on, Jane?
Yeah, sure. Perk test.
I just found the
get you
recycling calendar. I'll have to look at it. I'll look at it later.
All right, sounds good.
Yeah, I'm all for, I've always, Tom, we have this rule that within certain seasons that we can, and it will be out of season right now to be able to perk. And I personally have always been of, the state says we can do it all year round. So for asking for an extension, in my opinion, because I don't know if you've been through this yet, or have you, Tom?
As far as the extension for a perk?
Yes.
So basically what we're doing right now is we want, somebody pulled out a permit for a perk test.
Yes.
And we want to give them an extension on that.
To perform it, right, Paul?
Yes, so what you're referring to, Tom, was that we gave extensions for approved septic plans, but this request is to approve the request to conduct perk out of season. So right now, the perk season is April, May, June, September, October, November. And the state allows perk tests year round. So when the Board of Health redid our regulations in 2011, we kept a perk season, but we added the caveat that if someone wanted to do a perk season out of season, they needed permission. This request is just to conduct a perk test out of the normal perk season that's in our regulation. And in the past, we have always mentioned it, mostly. So that's what the perk out of season request.
Okay. So what benefit does having this regulation in place assure that we have good assessments of soil?
Well, it was in place for a while. It was we changed it because in order to properly identify the soil and describe it, you need to have moist conditions. So if it's a real wet, dry time, and you cannot evaluate the soil, then you get to wet the soil down with water, and that's the only reason why we have difficulty during a drought to identify the soil characteristics, because they're not dry and not moist. So therefore, you would have to have water source, hose or spray pump bottle, in order to saturate the profile to evaluate the soil. But that's usually during a drought condition. But we have a lot of drought conditions in June, September, and October. So using that theory really doesn't, make much sense, because during this time of year, there's definitely no dry soils out there now. So again, if someone wants to do perk in July on a big site when you don't have available for water, we would probably say no, because by someone's house at this time of year in the fall, that's not to identify soil because it's not dry.
Paul, I can hardly hear you. You're breaking up pretty bad. How's everybody else? Okay.
The only reason I understand it, Tom, is because I understand the rule that's in place. And can you hear me, Tom, completely? You can just say.
I can hear you good. Yeah,
okay.
Perfect.
The major rule that we put this in place really shouldn't have been, in my opinion, for this time of year. It would be strictly, in my opinion, for July, August, and September, your dry months, when you have very dry soils. You can't really read them as well. Paul could implement it, and it is a pain in the gut that you have to bring a spray bottle and wet everything down, and it's a pain. But, I mean, at some point, if we can change the regulations, that will be great, and we could eliminate that, because the state allows it all year round.
Paul, what do you think?
Yes, I agree with Blake. Can you hear me better now, Tom? Because I muted Bob and Jane. Can you hear me? Test one.
Yes, I can hear you. It's beautiful now. Can you see me now?
No, but I think having Bob and Jane in the same building 20 feet from me is what's causing a problem. So, yes, I agree with Blake. Basically, that's what I said. So it's in our regulation. Instead of revising the regulation, it was just easier to give the permission to perk out of season.
Okay.
But if you want, this winter, you get time in your hands, we can revise the septic regs if you want.
Yeah. Well, I do want to, you told me this is what I needed to learn about, not pandemics.
Exactly.
I have a feeling that all our regulations besides COVID stuff is on hold for a while.
Yeah, I get it.
All right, but you can hear me better now?
Yes, I can hear you much better now. Thank you.
Can you hear me, Jane, too, or no?
Can I hear Jane?
No, Jane, can you hear me? If you can, give me a thumbs up, Jane. I guess that's not a thumbs up.
She shook her head. I can hear her laughing in the other room.
Thumbs up.
Yeah. Crafton. Thumbs up. All right, next order, Mr. Chairman, you gotta unmute Mr. Chairman.
I think Paul needs an iPad.
Tell Bob he's muted.
Bob, you're muted. Paul
I
muted
know.
us.
There we go. We're back, Bob.
We're back. Jane wants some time off.
It
I
goes
can't
with
understand why she wants the day after Christmas.
I'm gonna hurt you, Paul, if you keep muting me.
Yeah, Jane, as usual, as long as you split the pay with me, Bob, and Tom, we're all good with it.
I'm fine with it.
Deal.
I'm good with it.
Yep. Fine.
All right, now we need to discuss the contract tracing.
I'm muting myself. I gotta use the bathroom real quick.
Well, I'm not
Contract
sure.
tracing hourly rate.
Well, I think that was already decided, Bob, in the emails that we sent out. So unless
Okay.
you changes, Jane added it because, you know,
All right.
but if you guys want to discuss it, Tom was involved. So if Tom wants to chime in on more background on that.
No, I don't think so. I don't need to.
Because it was discussed $35 for an RN and $25 for non-RN.
Right. And that excludes Diane.
Correct.
Okay. Yep.
What's gonna do, is there gonna be a contract or is it just gonna be, how are you gonna work that?
Well, as of right now, I checked with Stephanie and she said we can just submit an invoice like we did for the nurses that were involved in the flu clinic.
Okay.
But I told Diane to get the invoice and we'll submit it, that you'll do a trial run and submit it to Stephanie. If you want something different, then we can do something different. But I had checked to her before we started this process. And contract, just have it send us invoice, but if we have
Paul, you're breaking up again.
well, I got trouble last time I got rid of them. Click.
Yeah.
Click. All right, can you hear me now better, Tom?
Mm-hmm.
Yeah, so
Yes.
I checked with Stephanie and she said we could just do a typical invoice like we did for administration of the flu shots. So if she wants something different after the first invoice is submitted, we could do a contract and backdate it for whatever that month was. But I ran this by Stephanie prior to bringing it to the board's attention and discussing it. So she's aware what she wanted, and if we need something different, we can get it at that time.
Okay.
Are you good with that, Blake, for the contact tracing discussion?
I am. I heard it, Paul. I just had to use. Yeah, I was good with it. Yes. It was all in the emails that we did earlier too. About how much. Yep, I'm good with it. Yes.
Okay, review the changes to the trash calendar for the cash recycling flyer. All right.
I thought we just did that. Review
We did.
trash.
We did. It's in there.
Oh,
twice.
I'm like,
Sorry.
didn't we just do that? No, it's
Yeah.
above Paul. It's above Bob. You didn't say anything wrong. It's right above. If you look 4 sentences up, it says it's there 2 times.
Yeah, it is. Okay, the plan for 150 Main Street.
So yes, I have sent you guys, emailed you guys copy of the septic plan for 150. It's a septic repair for Chris Wild, 150 Main Street. straightforward Presby system with a 1-foot reduction of groundwater to make it gravity. Besides that, nothing special.
Okay, I'll sign that before I leave.
Okay, great.
Are you gonna leave
All
it
right,
for
the
us to
next one-
sign?
What's
Yeah,
that?
I can put it in the truck for you either tonight or tomorrow, whatever works for you guys.
I know, Paul, can I just say one thing? And
Sure.
I'm good at septics. No. Next time, and I know this one was a quick one. I think it came in yesterday, Paul, or maybe even this morning. I'm not sure. I forget the
Correct.
reviews. I looked at the computer. I mean, hopefully next time we maybe have an extra day or two. You know what I mean? I can't really see it on my computer that well, but I trust you. It's fine. I saw it was 4 feet, and I can't believe there's 2-minute material down there, which is unbelievable, which is good. But nope, I'm okay with it.
Anything else?
That's it. And
All
once
right,
again,
great.
Jane, Paul, you're going to leave it. I'm sorry, you're going to leave it in the truck. Is that what I heard?
Yes, I can leave it in the truck tonight after
So we
Bob
got-
signs it.
Yep, we might as well. So Tom and I can.
Tom's yawning. I seen him
I know.
yawning.
No, I'm not. I'm not yawning. I'm not yawning. I'm just a little tired. This is I'm glad these meetings are so easy to do.
I told you, Tom, it's only an hour every 2 weeks, you know? My wife's laughing in the background at me.
All right, what do we want to do about our next meeting? We
thought
gotta
we
have
said
one
the
for the
12th.
budget, right, soon?
Oh,
I guess we have time, you guys. These said February, so there's no rush.
Okay, all right.
well, Jane, why don't we put it number 1 priority on the 12th? Then? I think we said the 12th. I thought that's, I wrote down notes here.
That sounds great. We'll make it. We'll make that the budget meeting, and hopefully by
Yeah.
then, we got some more numbers coming in.
Yeah. And hopefully how's the septic load look, Paul? Are we lightening up?
No, I get 4 septics coming in. I haven't looked at them yet, but we'll get them. But I think this format, going virtual, I think a couple more iPads, a little more separation between Jim and I think we can work well. But I think it was good.
Worked better than I thought it was going to.
Can
All
I
I had to
ask
do
you?
was try it from home.
So, Paul, some things are not identified on here, like caller 01, which is fine. Is it
So that
identified with you?
That caller 01 is Tom. He called in. So when Tom
Oh,
calls, that lights
okay.
up.
Yeah,
the
and there's
other
just
caller, we're not quite sure who that is, but
Just-
caller 1 is Tom.
okay. That's the only one I didn't, understand. If you know what I'm saying. Absolutely. Oh, caller number 1. Got it.
Right.
Well, guys, this has been an adventure. Crafton, what are you going out into the? Oh, yeah, you can take it off, Jane.
But wait, I got a question. Did everyone get that chat comment?
Chat comment.
Oh, no, I didn't even look at it. I was too busy controlling people.
Well, it was,
What is chat?
it was from Merrimack. I
Oh,
didn't know
chat.
if you guys just read it.
Where is everyone? What does that mean?
There's a bubble up above that you can open up if you tap on it.
Oh, as a Merrimack resident. I'm sorry. Can you guys read it too? Because I'm gonna.
Where is it? Oh, it's a bubble.
It's a
Tom,
bubble.
if you see the bubble up above,
Yep.
and if you push it,
Tap
then
it.
you can open it up.
I didn't get a message. I just thought I see the chat, but I don't see a message. Is there a message in there?
Yeah,
Yeah,
there is.
I'll screenshot it for you, Tom, and I'll send it over to you.
Well, yeah, okay.
Should.
Hang on. I can screenshot it.
Not extend the youth groups. These local groups are usually governed by the state level. Whatever. Okay, so the district can support it.
Okay, all right.
That was interesting. Okay. With that said, guys, are everyone all set?
Yeah, I'm fine.
Paul, are you okay with us not having a meeting on the 22nd?
That's fine. And the way that chat works is you guys can type it. If you guys want to type a message into one individual, you can just say who you want. You can either send the message to everyone or just one person.
Well, I apologize for that. I didn't know how to use it. Next time, maybe you know what I mean? I'll be able to use it.
Yeah, I saw it, but I didn't know what it was either, so.
All right, Tom, quit laughing.
All right. Well, thank you guys for all getting through this with me, because it was painful, but it was good. I think we did a good job on this.
I do too,
Yeah, I think
Tom.
we did.
We just got to get you, hopefully we can get you an iPad for next meeting.
Why?
Yeah.
That way you can get some color in your face.
Yeah, you too.
Do I need some color, Paul?
No, you're red enough.
Yeah, I know. All right, ladies and gentlemen, have a good evening.
All right, thank
You
you.
too.
All right.
Thank you too,
Thanks,
guys.
Bye.
See you later.
Bye.
Bye.